It's such a privilege and delight to be here and to be talking about this crucially important issue in an environment where we can say, and we will say, and we will repeat that gun violence is a public health problem, but where we actually don't really have to say that, and where it's sort of taken for granted. To be on a panel with so many of my esteemed colleagues. So Elinore Kaufman, I'm a trauma surgeon at the University of Pennsylvania. So one of the things that I feel like I can bring to the conversation is some of the very sort of concrete piece of this. And I'm going to talk about some broader impacts of firearm violence, but I'm going to talk about this first and say, when we say that something is a public health problem, it's a health problem. And I'm on that right side of the diagram that Ruth showed in much of my life, trying my best to take care of people who are injured by firearms. And we hear a little bit more about the people who die, and every death related to gun violence is, of course, a human tragedy and a policy tragedy and a public health failing. But when it comes to community violence, these are old numbers, but the proportions haven't changed. About 3/4 of people who are shot survive. And that's partly, I hope, due to the work of me and my colleagues, and partly due to many other factors. But we don't think enough, and I'm going to talk a little bit more as we go on about those survivors and what this means for them. But I think also people sometimes ask, why are we perseverating on guns, and why are we perseverating on gun violence? And there could be no guns in America and there would still be violence, right? People would still do bad things to one another. And for me, as a surgeon with my very concrete thinking, this other figure on the right is why. Because when I am in the emergency department, one of the worst things that we hear when we get notified that a patient is coming in, after a penetrating trauma, they're in arrest, right? They've died en route to the hospital. And now our job is going to be to try to bring them back to life and to try to make that death transient. And so one of the most dramatic things that I do in my job is something called a resuscitative thoracotomy. And the clinical details don't matter so much, but we do, but we will open someone's chest, clamp their aorta, massage their heart, try to control the bleeding inside their chest to try to bring them back to life. And it works sometimes. And when I hear that person is coming in, all I want is a stab wound. All I'm hoping for when that person is on the way is that they were stabbed in the heart. Not that I want anyone to be stabbed in the heart, but you know what I'm saying. Because our chances of finding a problem we can fix when the weapon was a knife with a small point, then when the weapon is a bullet that travels through and destroys tissue, our chances of success are so much higher. And so we do have more stabbings every year in the United States. This may not be true in Philadelphia, but it is true broadly. But the number of survivors is just astronomically higher. So that's kind of, and you'll hear more about this from others, I'm sure, but this is what we mean when we say that although many people have guns in their home or carry guns with them in an attempt to protect themselves in a world that feels and is dangerous, the evidence shows us that firearms are associated with the owner or the resident having a double risk of dying due to homicide, a 3 times risk of dying due to suicide, 5 times the risk of being shot by someone else during an assault, and 7 times the risk of an intimate partner homicide. And so all of these things, all of these assaults, all of the intimate partner violence might be present, whether the gun was present or not, but the consequences are really, really very different depending on the means. So for me, it's always a both and. It's always the root causes of violence and the conditions that set us up for these interactions, but it's also, can we get our people to survive violence so that we have a second chance to address those root causes, so that we have more time to work on the policy and to work on the social conditions and to work on the systemic racism? Can we just get our people to survive? And that's what brings me to the next thing I want to talk about, which is most patients do survive, but how many really thrive? Like I told you, about 3 in 4 patients survive. And this is just one example, but up to half of survivors have a major mental health consequence of their injury and develop depression or PTSD, which just goes to show us that the impacts on individuals go beyond the physical stuff that I deal with. The emotional individuals are profound. And it's not just the individual, like Dr. Abaya was telling us, it's the community, those who are directly affected and those who are living in neighborhoods that are changed by the presence of firearm violence. It affects us all as a society because of the costs and the opportunity costs that we pay here. What we want when we see people injured and they come into us for treatment is we want them to get better. We want them to go back to being superheroes and having dance parties. Sometimes it takes a little longer, but some people never get there, right? Some people have long-lasting mental or physical limitations. It's really difficult to quantify some of this, and this is had to go to this Canadian study to try to get a sense of just the physical disability. So these are disability claims after firearm injury. So up to 10% in the first year and then 20% over the longer time frame of people with intentional firearm injuries are requiring disability support. And this is reflected in data from Philadelphia, in which survivors were reporting 65% of survivors are reporting worse physical health, 55% worse mental health, physical function is worse, emotional support is worse, and people are not able to participate in their usual social roles and activities, are not able to get back to their full lives with dance parties and superheroes the way we want. Another way of looking at this, of course, is in monetary terms. So each firearm fatality costs us as a society around $270,000, each injury around $50,000. And this is medical costs, this is criminal legal costs, this is long-term medical care as well. Another way of thinking of this is, by who's paying every day. The government, businesses, and families are contributing to these bills, and this sort of unquantified but attempted to quantify losses in terms of pain and suffering that people are experiencing. One of the really leading public health scholars in this field is our neighbor here in Philadelphia, is John Rich. And if you haven't read this paper, which is maybe the short version, or his really wonderful book called Wrong Place, Wrong Time, I really encourage you to do so. They really frame the way that I try to think about these things, and really foundational, I think. But for this study, this was done in Boston, but I think the themes carry over the last 16 years and across space to say that when a person suffers a violent injury, it has these really profound effects. And they identified 3 major processes that lead to a disrupted sense of safety. People have symptoms of traumatic stress, with about 60% of the people that they interviewed met full criteria for post-traumatic stress, but 100% had the symptom of hypervigilance. And hypervigilance is a particularly dangerous symptom, right? Because it leads you to perhaps engage in behaviors that are otherwise risky. Perhaps it leads you to carry a weapon, to react more quickly to situations that are threatening, right? There's a lack of faith in police and institutions, and there's this need to regain a sense of self and regain a sense of respect. All of these problems taken together put patients at risk for incomplete recovery and for re-injury, and these are some of the details of the response. So people are carrying weapons, people are more likely to use substances or use them in a different way to manage their symptoms. This kind of information, I think, should lead us to think broadly about what it means to recover from a firearm injury. And there's many different ways that communities and providers can provide support to recovering patients. But over the last 20 years, one of the mechanisms for this that has really grown is a network of hospital-based violence intervention programs. Because those of us who take care of firearm injured patients, and when we get someone's heart restarted, or it never stopped, but we're able to treat their injuries and we're able to get them out of the hospital, and we pat ourselves on the back that our job is done, we're not correct. because of everything that I've been saying and the many, many challenges that face people. So this is just a list of some of the services that people need and that hospital-based violence programs in this particular study were able to provide. Mental health care is one of the biggest, which is no surprise. Financial support in terms of victims of crime compensation, support in terms of applying for jobs, getting back into school, housing challenges, et cetera, et cetera. It really takes a very broad perspective to get people back to their full lives. But programs that do these kinds of comprehensive services help. Patients are less likely to be involved in violent crime or to be involved in the criminal justice system. They feel better, which is really the thing that, I don't know, matters to me the most. But they also have decreased substance use and are less likely to be injured again, which I think helps all of us. So these programs don't have to be in hospitals. They often are, but I think thinking really, really broadly about not only what leads to violence, but what comes of it is essential to helping people and communities recover, which is what we want. And I will turn over the floor just to say that gun violence is violence, and it's also guns, and we can work on both, and we have to work on both at the same time. As Dr. Avaya talked about, the impact is pervasive, but it's highly inequitable and highly correlated with the structural inequities in our society. The long-term outcomes are unknown, not completely known, not fully explored, but are not great. But there's so much that we can do, and it's a great time to be working in this area. Thank you so much.